So did you all see the issue? What's the issue going on? The what they call antibiotic resistance. So what is resistance? Resistance means that the bug, what they call superbug, is resistant to the currently available treatment. So what is usually effective in terms of treatment will not work if you are getting a drug-resistant infection. And that's what is happening in a large part of tuberculosis infection in the world. Okay, and so there are people like Paul Farmer and Jim King trying to do some work in Lima, Peru, and other parts of the world. For those who are interested in their work, they actually have a big NGO called Partners in Health. Have you heard Partners in Health? Anybody? No? Okay, there's a book called Mountains Beyond Mountains describing the work by Paul Farmer, and it's really, really inspiring, and I encourage you to read it. Anyway, so let's just talk about the disease, tuberculosis or TB. So TB is is tuberculosis, and it's an infectious disease. Just like the smallpox, it has been with human beings for thousands of years. And in fact, in the ancient mummies, they actually discovered these bacterial infection, in the dead body of the mummies. And actually, during the history, lots of people got infected by TB, including some very famous physicians. Do you want to guess who's infected, who had been infected by TB? Chopin, Grieg, Wagner. Oh, we have a tie here. It's actually a multiple choice question. So the death certificate of Chopin, the reason of death for Chopin is actually claimed to be TB. So Chopin died at the age of 40 after a massive cough with blood. So he coughed, and with a lot of blood in his cough, in his sputum, and then he died. And then it was said that he died of the disease TB. And Grieg was found to contract TB while he was studying in the conservatory, and he was left with only one side of the lung functioning. So he had to live his life just with 50% of his lung. So he can be very dyspneic. He had some difficulty in breathing throughout his life. Still, he composed very good songs. And also some Chinese, very famous Chinese writers contracted TB. Might be a big challenge for international students. Yeah. You don't know any of them? You should know. They're important persons in Chinese literature. Anyone study Chinese literature? I think we do. Do you know them? A couple, okay. So the answer is Lu Xun. Lu Xun actually he's a heavy smoker. He was a heavy smoker and smoked a lot. And then he got TB. And actually somebody said he died of TB. Okay, so in history, TB used to be a very, very important cause of death in human society. But during the early 20th century, or the first half of the 20th century, there was a huge decline in TB incidence and mortality in the Western society. This is the statistics in England and Wales. So as you can see, there's a huge decline in TB disease and mortality. Again, causing optimism that the disease might not be a threat anymore to human society. But if you look at the numbers now in 2009, every year about 10 million people have the disease, new cases of disease, and about 14 million people are having the existing case of disease, and 1.7 million of them actually die. And what is even more surprising, as you just heard from the video, about 1/3 of the population is latently infected by the disease. Can you imagine 1/3? Which means that if this is in this classroom, about 30 people in this classroom are latently infected. In fact, I'm sure that there are latently infected people in this classroom. But don't panic, because they are not infectious. They just has the potential to become an active disease and spread to others. Okay, so 1/3 so 2 billion of the people is latently infected by the disease. Just very briefly about two terms that is very common in global health, and I feel like I need to introduce these two terms to you. One is incidence, and the other is prevalence. Okay, these are very important concepts. Incidence is a measure of disease frequency in terms of the onset. So the incident case means new case, not old case, over a period of time. And on the other hand, the prevalence is a measure of existing disease status over a snapshot, just the existence of disease, whether it's a new case or it's an old case. Okay, so if it's hard to imagine, you can imagine by looking at this pool. So the incidence means that the water that is coming into the pool. So the new water that is going into the pool. And you can imagine prevalence as the amount of the water that is already in the pool. So including the new water and the sort of old water. Okay, so if you go back to the figure, 9.4 million incident cases means that in the year of 2009, there were about 10 million new cases happening in that year. And 14 million prevalent cases means that, including new cases and old cases, there were about 14 million cases in that year at a snapshot. Okay, so this makes our basic introduction of the health measure. So you have learned the infant mortality rate, life expectancy, maternal mortality ratio, something, and there are two new terms, which is incidence and prevalence. So now you're familiar with all these terms, then you could now start with reading the literature of global health. Okay? Questions about incidence and prevalence? And in the homework assignment that you'll do in the next hour, you will be asked to choose one health indicator of your interest, and you can choose incidence, you can use prevalence, you can choose life expectancy, or any other health indicators that you're interested in. So this is the global distribution of TB cases, TB incidence in 2010. And you can go and find out your region. The region that is most heavily afflicted by the disease is the sub-Saharan African region. So looking at there, it's mostly due to the rapid and bad expansion of HIV infection in this region. So HIV is a very, very important risk factor or cause of TB infection or TB disease. So you can see in areas with high HIV infection, it also has the highest TB incidence. And also we have here South Asia, Southeast Asia, and China, Russia, and also South American countries. And how is the disease spread from person to person? This is not a multiple choice, but the disease could spread through many different pathways. But I wanted you to identify a route that is not how TB is transmitted. Spitting, coughing, sneezing, sharing foods, touching, singing, talking loud. I have touching, okay, good, and singing. So TB is a disease that is spread through airborne transmission. By airborne, I mean the air you breathe in could cause you to get TB. So it's not just, it's somewhat different from influenza or from SARS that we were talking about. It's through the very, very small, what we call droplet or droplet nuclei that could sustain in the air. So if a person coughs, like this guy here, or if a person actually speak or sing, when we talk, the vocal cord in our larynx, in our throat, would vibrate very quickly when we talk, the vocal cord. So the vocal cord would generate this very, very small droplet that will be in the air for more than 30 minutes. And it is when you breathe these air into your lung, not just into your mouth or not into your nose, into your lung, that will cause this infection. So in fact, singing is a very high risk factor for TB. If someone is singing next to you, stay away from him. Okay, and sneezing, coughing, or even talking loudly. Okay, but if you share some food with them, or if you touch them, it won't cause the transmission of the disease. Okay, it needs to reach the deep part of the lung. It's an airborne infection. You need to breathe this particle inside your lung. In fact, I'm looking at Jenny. Jenny, one of our good students from this Department of Public Health, she's doing some very interesting study in Malawi. So three of our students just came back from Malawi, and each of them has done some study in Malawi, and Jenny is interested in the household, the ventilation, of the household, whether poor ventilation in the household could increase the risk of TB transmission. And she actually found some very important, interesting finding. Maybe you can share with us next time. You probably need to know the natural history of TB, how the disease progressed inside a human body. So when a person has some contact with an infectious, TB cases, he or she might be infected or might not be infected, but most of the time the infection is called latent, which means that the bug is dormant, is sleeping inside your body. And for 90% of the population, the disease will remain dormant and you will be disease-free throughout your life. Okay, so for the 1/3 of the population, 90% of them, who are latent infected, they will be disease-free. And just about 10% of them will become actively infected with the disease and has the potential to transmit to other people. Okay, so don't panic if you know someone is latently infected. He's not infectious and he'll be fine most of the time throughout his life. And what are some of the challenges in TB control? There are many challenges, and I'm just raising some key points here. So we just saw that HIV is a huge issue and is a main risk factor for TB. And also we saw from the video clip that drug resistance is threatening TB control in many parts of the country, and there's issue of emerging other risk factors that I'll touch on later. So one thing you should learn about TB is that as long as the disease is not drug resistant, a simple antibiotic treatment could effectively cure the disease 95% of the time. So it's not something that is not curable. It's not something that is deadly. So here we have one patient who has this active TB disease. You can see he's very skinny. In fact, in ancient time, TB, the name of TB is called consumption. They call TB a disease of consumption, which means that disease actually consumes a person. So people can be like this, and without treatment, 50% or more of them would die. But with very effective treatment, with just first-line antibiotic treatment, the guy can be like this, totally disease-free, and he can be good for the rest of his life. But here's a challenge. In order to cure the disease, a person will need to take a handful. It's in fact a big handful of medications daily, every day, for 6 months. At least 6 months, and some up to one year or even longer. Do you want to take this every day? Okay. And this is what a TB patient, a typical TB patient, has to take every day. Okay, and for at least 6 months. And what is even worse is that these medications has a lot of side effects. Side effects, bad reactions, including liver toxicity. So some people will develop nausea, they throw up, vomit, and skin reaction. Hypersensitivity, allergic skin reaction, and even this color blindness. You have problem in telling which color is what. So it's really a big challenge for these patients to remain on treatment for 6 months. What is even worse is that these patients often feel a dramatic improvement just by 1 month or 2 months of treatment. So they'll feel, I'm good. I don't need to take a 6 months treatment. I can stop it. So one of the biggest challenge is how to make sure that these people is on treatment for 6 months. And guess what will happen if they quit their drugs for 1 month or 2 months? What will happen to them? The disease will come back. Great. One more. Exactly, drug resistance. Okay, so 2 very, very bad consequences of not completing the treatment. One is the disease will come back or relapse, after 6 months or 1 year. Although they feel that they are cured, but they are not cured. There are some residual bugs in their body, and after a while the disease will come back. But this is only bad for himself. What is probably even worse is the development of drug resistance, as you just saw from the video clip. The bad thing for drug resistance is that if you put them on the same treatment, it's no longer effective. You need to provide them with other different drugs that is more costly and more toxic, that has more side effects. And what is even worse is that these people with drug resistance, now they have the potential to what? To spread the disease to other people. So some people, they never got infected by TB, but once they got infected, they're infected with this drug-resistant TB. So you can no longer treat them with this first-line treatment. You have to treat them with the second-line or even third-line medications. So the take-home message is that it's extremely important to make sure that these people are put on treatment. And you help them through this 6 months period by making sure they're their side effects, most of the side effects can be managed. It's not that you have to tolerate that. Actually, we have some medications for that, and we can adjust the medication, the TB medication, to help these patients through these treatments. But they need help. So one of the key issue, or one of the key components of TB treatment, is to make these patients on treatment. And sort of the standard way of caring for TB patients is the directly observed therapy, which means that you make sure that these patients are taking medications every day in front of you. Okay, in front of you, which means that either the patients will need to travel to the health center or to whatever the healthcare facility is, or the healthcare personnel, they'll need to travel to the patient's home to make sure they eat the medication every day and make sure they swallow it. And when they have some side effects, they can help them to manage that. And this is I would say, the one single most important component of TB control currently being used in the world. But now here's the issue. You imagine here in Africa, rural area, how could you make people travel, walking to 2 to 3 hours to the healthcare facility? Or if you have only one nurse and you have to take care of 10 patients, they live in different parts of the region, how could one nurse travel to different places? Unless they have a motorcycle, right? We saw the motorcycle story last time, but many of the places they don't have it. So the directly observed therapy is a good idea, but in a practical sense, we need to come up with some new ways to do this, especially in rural areas. So in response to our what you're discussing in the first hour, people are actually thinking of using mobile phone, but the video mobile phone, to help implementing this thought. So what do they do? So for those who need to be on directly observed therapy, they lend a video mobile phone to these people. So you don't need to go to the patient's home. You just make sure that they use video mobile phone, like present it to you and swallow the medication. Isn't that good? So this is one potential idea of using modern technology or 3C tools to help infectious disease control. And in fact, people have been doing that in rural Kenya. And the preliminary pilot study suggests that these may be a feasible way of doing this directly observed therapy. Questions? Or do you think this is workable?
The cost of this method, is it affordable for those residents in those countries?
You are
Sorry.
Bojun. So Bojun said, is it affordable to these countries? So mobile phone, we know mobile phone is widely available in Africa. But now we need a video mobile phone, which is probably more costly. So the idea now is not that you give this tool to these patients. You just lend them, During these 6 months, you just, they can borrow the phone from you. And when they are cured, you need to take the phone back. And of course, the cost needs to be weighed against, other alternatives. Say, what are the alternatives? You have the nurses travel to each patient's home, using motorcycle or using, other different tools. Or if you have some other cheaper ways to have the patients come to your places. Okay. This is a good point that for each of these new interventions, you need to consider the cost against the effectiveness, and the cost effectiveness of the new intervention. And if if it turns out that this intervention is worth your money, worth the money you invest in these tools, then you probably want to do it. In fact, Nokia, as far as I know, Nokia was sponsoring these kind of activities. So if you want to do this, you could go to Nokia and say, I want to do this. Why don't you give me $10 million, dollars or 1,000 mobile phones to do that? I think they'll be glad to do. Okay. I think I'm gonna stop here because we want to finish on time. So in the third hour, we're going to no more new work, but we'll let you practice your homework. We'll let you do your homework on site. You don't need to finish that here, but we'll just give you some time to practice it. And so the homework, the assignment one has been posted on CBOM. You can look at that. And essentially, you need to pick one health indicator of your interest. So we have gone through life expectancy, neonatal mortality, infant mortality, and we just went through incidence, prevalence of different diseases. And then from your region, from each of your own region, you pick 2 countries. One country with a high value and one country with a low value of that indicator. And you will propose a possible determinant of that indicator. And we wanted you to do something like this. And so this is Professor Zhang's paper, your homework, your assigned reading in week 1 and week 2. This graph suggests that, at a global scale, when the per capita GDP increases throughout these years, the life expectancy actually follows the same pattern. So we want you to find out, you don't have to do life expectancy. You can do any indicator that you're interested in. And you don't need to do GDP. You just pick anything you want, like literacy rates, like mobile phone coverage, something like that, and come up with a similar kind of approach. And then we want you to write a short essay